Makan. Okay, so coming from the root, we have two important nerves, which are the dorsal scapular nerve and long thoracic nerve, which supplies these muscles here lah. Don't worry too much about what muscle it supplies, because you will revisit this during the lectures that cover the area lah. So for example, the serratus anterior and so on, you will cover with the muscles nanti lah, the muscles with the nerves together lah. Okay, so for this lecture, you only need to know the branches, the name of the branches. Okay, so from the trunks, you have suprascapular nerve and nerve to subclavius. Okay, and from the lateral cord, there are three main nerves. Okay, you have the lateral pectoral nerve, the lateral root of the median nerve, and also the musculocutaneous nerve. Coming from the medial cord, you have 5 branches. Okay, medial pectoral, your medial root of the median nerve, the medial cutaneous nerve of forearm, and medial cutaneous nerve of the arm as well, which is not seen in this picture lah, because it's further down. Okay, and also you have medial root of median nerve and ulnar nerve lah. So 1, 2, 3, 4. The other one is medial cutaneous nerve of arm. Okay, 5. Branches of the posterior cord, you have upper subscapular and lower subscapular, axillary nerve, nerve to latissimus dorsi, and your radial nerve. Okay, so you will see, you can also see all these in this picture here lah. Okay, so here I'm just going through one by one the nerves coming from the different areas lah. Okay, so brachial plexus injury is normally grouped into 2 main injuries, whether it's upper trunk or lower trunk. Okay, so in upper trunk injury, C5 and C6 is involved, right? Because C5 and C6 joins to form the upper trunk or superior trunk. Okay, so this is normally when during birth injuries, when during traction or pulling of the head during delivery, the shoulder is stuck. Okay, so the doctor will pull the head, but the shoulder is stuck, so this can injure the upper trunk of the brachial plexus. So here I'll show you a picture. So the shoulder is stuck here, and the brachial plexus is stretched due to traction or pulling of the baby's head during delivery. Okay, you imagine this part is really stretched and cause injury, or sometimes snap. The brachial plexus is snapped at this C5 and C6 area. Okay, so this will cause injury to the upper trunk. Okay, and the deformity is called Erb's paralysis or waiter's tip position. So the arm is like this. You know, waiters, when they ask for tip, that's how the hand is positioned lah. Okay. So what is the waiter's tip position? The arm is adducted and medially rotated. The forearm is extended and prolated, and the hand is flexed at the wrist. So this is the position. Okay, it can also happen in adults. Okay, usually when they stretch the upper trunk here by falling like this. Okay, and again this will cause the Erb's paralysis or waiter's tips position here. Okay, like this. Okay, so lower trunk injury is called Klumpke's paralysis. Lower trunk is CAN-T1 lah. Okay, and this is caused by usually there are 3 main causes. Hyperabduction of the shoulder is grasping something to prevent fall on the ground. Okay, so for example, this is a common scenario where someone is falling and they kind of pull onto something or hold onto something and stretch this lower trunk of the brachial plexus. Okay, and what will happen? Injury to the nerves there, or injury to the lower trunk which is C8NT1, will cause motor loss or paralysis of the flexors of the wrist and fingers, and also paralysis of the small muscles of the hand. Okay, and also there is sensory loss of the sensation over the middle side of the arm and forearm, and the deformity due to this motor loss is called the complete claw hand deformity. Okay, so what is the complete claw hand deformity? Extension of the metacarpophalangeal joints and flexion of the interphalangeal joints, which will look like this, like a clawed hand. Okay, so you can see flexion of the interphalangeal joints, which is here, and flexion interphalangeal joints here, so the extension of the metacarpophalangeal joints. Okay, you will learn more about these joints during the hand lecture lah. Okay, the arm and forearm and so on. But just to introduce to you the words here. So the deformity is called complete claw hand. Okay, so in a nutshell, if it is an upper trunk injury, it will cause Erb's palsy. Okay, usually it's overstretching of the neck. Okay, so and the lowest injury will cause Klumpke's palsy, okay, or Klumpke's paralysis. So Erb's palsy is waiter stick position. Klumpke's palsy is your claw hand deformity. Okay, so in obstetric or in babies delivery, both can happen actually, depending on how the procedure. Okay, so the upper plexus injury, but if the arm is pulled, it can cause the lower brachial plexus injury. Okay, so if, say for example, a baby is born and the arm looks like a waiter stick position, then you know the injury is at the upper brachial plexus. But if the baby is born and suddenly the hands are continuing to be like a claw shape, so you know there might be a lower brachial plexus injury. Okay, so sorry, I have, but if you have questions, you're free to email or text me, WhatsApp me. If you have any questions, is that okay?
Alright, so I released the attendance for this class. Do fill it up.